Good day, everyone. I hope you are enjoying springtime. It's raining today on the farm, so it seemed like a really good time to do this episode. So, this month's episode is devoted to understanding and exploring the condition that affects at least 10% of women in their reproductive years. Now, in researching endometriosis, I utilized AI to help pull and synthesize the information found on the web. Given the vast amount of material available, I was in need of some help. However, I will say the material found was in raw form with many gaps, so this writing is not auto-generated, just assisted. As you may know, with AI technology, you need to guide or train it and double-check sources to ensure quality. Now, I'd like to begin each episode with some historical framework, which I believe may provide some perspective on the subject. The name or term endometriosis is the modern medical term to describe a chronic condition associated with pelvic pain, heavy menstrual bleeding, and even fertility issues. You might be surprised to know that over 4,000 years ago, there were medical texts from Egypt and Greece containing descriptions of the same condition. Unfortunately, great misunderstanding of a woman's anatomy gave rise to the term hysteria, which began as a description of the cluster of symptoms, but ended up being a pejorative term for women being overly emotional or even mad or crazy or hysterical. So, hysteria, or rather hystera, is the Greek word for womb or uterus. And with continued ignorance of anatomy and the spread of Christianity, women during the Middle Ages experiencing these symptoms were sometimes viewed as, believe it or not, sinful or possessed by evil forces or engaging in witchcraft. Finally, with the age of enlightenment and with the advancement of tools such as the microscope, more information was gathered to dispel misconceptions and clearly identify a physical condition. Today, the tool, the laparoscopy, which is a small flexible tube with a light and camera, provides a visualization of the lesions, thereby definitively confirming the condition known as endometriosis. Now, broadly speaking, endometriosis occurs when endometrial cells, which are normally found growing and shedding from the lining of the uterus during menstruation, grow and create lesions outside of the uterus in sites such as the ovaries and fallopian tubes. Now, there are documented cases of its growth in other areas, including the rectum, bladder, urinary tract, vagina, intestines, and while extremely rare, even the heart and lungs. And despite advances in our understanding, there is much debate on its cause or causes. Currently, endometriosis is viewed as a complex systemic condition involving inflammation, hormonal imbalance, and immune dysfunction. Some symptoms, according to the Mayo Clinic, include the chronic pelvic pain and painful periods and cramping that often radiates to the lower back and abdomen, pain experienced during or after sex, pain with bowel movements or urination, excessive bleeding or spotting between periods, and lastly, infertility, since the growth of endometrial cells can interfere with ovulation, fertilization, and pregnancy. Now, this blog is known as Understanding, like the Human Condition. So I'd be remiss if I didn't mention that the psychological toll that chronic endometriosis can take cannot be underestimated. A few of the common impacts include depression and anxiety, lowered quality of life due to persistent pain, shame and self-blame, especially in regards to fertility, emotional exhaustion, negative self-image, and reduced confidence. Now, the first or primary explanation for the condition is known as retrograde menstruation. This occurs when menstrual blood flows backward through the fallopian tubes into the pelvic cavity instead of leaving the body. Now, the second theory involves the immune system or its dysregulation, as the system may fail to clear those endometrial cells fully during menstruation. This might explain why endometriosis has been linked with other immune-related conditions like lupus or inflammatory bowel disease, with one study finding a 50% increased risk of IBD in women with endometriosis. Emerging research is indicating that environmental exposures, particularly to certain pesticides, may play a role through endocrine disruption, oxidative stress, and inflammation. This includes the phthalates, the PAEs, found in plastics, which may disrupt hormones, and the polycyclic aromatic hydrocarbons, or PAH, released in air, food, and tobacco via high temperatures and combustion. Furthermore, there is a confusion or lack of clarity in the role that phytoestrogens, or plant-derived compounds with estrogenic activity, play in the condition. In one of the latest studies from 2025, phytoestrogens from non-pesticide sources are now viewed as providing protective effects via hormone regulation and reducing inflammation. So there has been a confusion between like a crop such as soybeans, which is in some cases been shown as beneficial and then in some cases shown as harmful. So now that we kind of know that pesticides plays a role in terms of exacerbating the symptoms of endometriosis, if you just focus on those chemical-free, non-sprayed crops, apparently the study shows that they can provide a protective effect. It's just when the spraying comes in or the pesticide treatment comes in that the waters, if you will, become muddied. And of course, a genetic component is also believed as it tends to run in families with a higher risk associated if a mother, sister, or grandmother has had the condition. Thirdly, elevated levels of estrogen circulating, the growth and survival of endometrial-like tissue outside the uterus, and increased inflammation ensues. Now, I asked AI to build a simple timeline to demonstrate how it can become a chronic disease. And here's the scenario. Step 1. There's a normal menstrual cycle. With the uterus builds lining called the endometrium, and if no pregnancy, the lining sheds as a period. Step 2. Retrograde menstruation, backward flow. Some menstrual blood flowing backward through the fallopian tubes into the pelvic cavity. This carries endometrial cells. Step 3. Cells enter pelvic cavity. Endometrial cells reach the ovaries, the pelvic lining, ligaments, bladder, bowel, etc. These cells should normally be cleared by the immune system. Step 4. Cells stick and survive due to lack of clearing and because of genetic, hormonal, or immune factors. These cells attach to surfaces and survive and grow instead of dying and being cleared from the system. Step 5. Due to lack of clearance from the immune system, lesions form and grow, with the cells responding to estrogen continue to grow and thicken with each menstrual cycle. So this is a time when bleeding internally during periods may occur. With this growth, lesions or spots of cells and cysts, known as endometriomas, and also deep nodules may persist. Step 6. With repeated bleeding and irritation, inflammation and scar tissue, known as fibrosis, may arise, leading to the pelvic pain, pain during sex, bowel movements, urination, and possibly infertility. And step 7. Over time, lesions can spread or deepen. Nerves may grow into lesions, creating more pain, and the condition becomes chronic. Now, other key factors associated with endometriosis include an early first period, short menstrual cycles, such as less than 27 days, heavy or long periods lasting more than 7 to 8 days, high estrogen levels, and having never given birth. Some interesting studies also show that women with the condition often have different bacterial patterns compared to those without the condition. These differences appear in the vagina, uterus, fallopian tubes, pelvic cavity, and even the gut. This suggests that endometriosis may be linked to a broader imbalance in the body's microbial communities. So a promising area study is focused on restoring healthy vaginal or gut bacteria. There are approved and scientifically unsubstantiated treatment options. Standard protocols include pain medication, hormonal therapy, imaging or laparoscopy if symptoms persist, surgery if needed, fertility treatment if trying to conceive, and supportive therapies throughout. There's also like this idea about putting yourself in menopause to help reduce the number of times that you actually have a menstrual cycle. I had to coax the AI for alternative or unsubstantiated approaches. And in doing so, it recognized that things such as anti inflammatory foods can influence the inflammation, can reduce it, hormones to balance it, and gut health, all of which play a role in the condition. So, some recommendations include reducing processed foods and excess sugar, increasing your omega 3s by eating things such as wild caught salmon, organic walnuts, organic flaxseed, eating more fiber rich fruits and vegetables, limiting red meat, which is linked to higher risk, reducing or limiting dairy to reduce hormonal load. There exist numerous studies confirming the use of probiotics, those living microorganisms such as lactobacillus and bifidobacterium, as beneficial for reproductive health in general. And although studies exclusively for endometriosis is scarce, the use of probiotics is gaining support as a possible treatment approach. And even though I'm not personally affected by endometriosis, I do consume a small glass of raw milk kefir with the fermentation to support my overall digestive and bone health for my stage of life. Now, to manage the chronic pain, yoga, meditation, breathing techniques, and targeted exercise for the pelvic region, along with heat therapy, such as warm baths, heating pads, and of course, an optimal sleep schedule may work alongside the official treatment plans. One area for concern is that high impact aerobic exercise may actually worsen symptoms or flare ups of the pain symptoms. So, in general, low impact aerobic exercises such as walking, swimming, and stationary cycling are seen as beneficial for improving your mood, lowering your oxidative stress, reducing circulating estrogen and body fat percentages. Lastly, while scientific studies are lacking, the benefits of sipping a few cups of red raspberry leaf tea is well known in traditional medicine circles for balancing hormone levels and reducing cramping during menstruation and for menopausal symptoms, such as hot flashes as well. That's what I have for today in this episode of Understanding Endometriosis. I hope it's been educational and helpful to those of you who have had or know someone who is dealing with this condition. Please do leave a comment and share your thoughts and experiences. Thank you for listening and have a blessed rest of your day.